Welcome back, listeners and viewers. Welcome back to the Eyecare Experts. We're back again talking a little bit today about women's eye health and safety, because it's certainly going to be the month forward in April. I'm Dr. Bell with Dr. Teresa. Going to introduce yourself, or let's say a few words.
So I'm the old guy that started this thing in '75. Bell came with me a number of years ago, and we now have 5 locations and 8 doctors, and we're very proud of that. And we pride ourselves on doing specialty work that other people don't do, and that fits right in with Women's Eye Health and Safety Month.
Well, I know they generally say that time speeds up as you get older, and certainly I know that to be true. It's amazing. And next year, 2025, it will be 50 years since you bought your first practice there in Milton, Florida.
That's correct.
Can you believe that? 50 years. Well, let's go through a little bit. I mean, again, the topic here, women's eye health and safety. One of the things as far as everyone, but especially women, sometimes have a higher prevalence of many of the major vision problems that we deal with day to day. One of those being age-related macular degeneration. One of the things that with ARMD is, since I graduated, at first, way back in the days, all we could get were nutrients and supplements and things like that to help them. And there's been a lot of advances with anti-VEGF, a lot of injections as far as not only slowing the progression of macular degeneration, but sometimes even improving vision in some of those patients. So ARMD, that's a big one. And certainly the big thing too is genetic testing. Nowadays, if you have I get the question every day, hey, my mom or I have a family member who has macular degeneration, what are the chances that I get it?
Well, we're fortunate in that we have a machine called a Maculogic, which in fact is a virtual reality machine that can find evidence of ARMD based on your responses to certain targets and find out your proclivity to developing ARMD by 2 years prior to any doctor seeing it. So if there's a genetic history in your family, it'd be good to know that and pin it down and then start treatment as early as possible.
And we may differ on this, but this is probably a good time to discuss. What happens if someone says, hey, my mom has macular degeneration, and you look in the back of the eye, and this, the daughter doesn't. But let's say she's 50 years old, and she says, hey, my mom's already taken, supplements, AREDS2 formula. Would it be a good idea for me to go ahead and start on that? What do you usually tell that patient?
Well, I don't argue against it. However, I run the Maculogic. If they pass that test, which is much more sensitive than just a visual look at the back of the eye, regardless of who it is, then I just tell them to wait and let's see if we get some symptoms in before we get started.
And I'm in agreement with that. Most of the studies that I've read, certainly it won't hurt to use it early, but sometimes that's a lot of money you're spending before any symptoms, show up. So I usually tell those patients we're going to watch you closely, and the minute we see any, changes in that macular area or any signs of maybe the starts of macular degeneration, then we would certainly start you on those supplements. But before then, there's little studies to show that much benefit of doing it years before you get to that point. But another topic besides its high prevalence is cataracts. And I think there's a misconception, sometimes with patients, what are cataracts, or they get cataracts and maybe glaucoma confused. Cataracts, if you talk about, the lens in the eye from being outside in the sunlight, the UV light, it gets a little bit hard, it gets a little bit cloudy. Maybe, as we all get older, it gets a little bit harder to see things, maybe night glare. With cataracts, certainly, I usually say we're all probably going to get some sort of cataracts. That doesn't mean we're all going to need surgery, but usually we do get some changes in the lens as far as that.
Yeah, people are living longer, so the incidence of these diseases, particularly in the older population, the fastest growing population in the United States right now is over 75, with a lowered birth rate and other issues we have in society. That's causing these diseases to be more prevalent. So there'll be a big peak here in the next 10 to 20 years.
That's a very good point. And I know for me personally, my night vision, and one of the reasons certainly is lens changes that definitely plays a little bit of a role in that. But the next topic is dry eyes, and I think day in and day out, tear film issues, dry eyes, lid issues is by far the number one complaint that I have as far as patients coming in.
Absolutely.
And it could be as simple as, hey, they're gritty, they're sandy, or I'm having to blink to clear things, or I'm staring at the computer all day, or I'm taking certain medications, antihistamines, things like that may dry out the eyes. I'm sleeping under ceiling fans. I don't blink enough. There's so many variables in that as far as dry eyes.
It's very much the Wild West in treatment of that and in diagnosis of that. That's why a lot of clinics do not fool with it, because it's more art than science at this point. But I have to say that's precisely what attracts me and some of the doctors with me to do those cases. And then the satisfaction you get when you fix it is significant.
Well, I think in the simplest explanation, there's so many factors that would cause you to have dry eyes that you have to determine what the cause is before you know how to treat it. You know, a lot of times, the older days, we'd say, hey, just go get you some artificial tears or re-wetting drops. And that may help a small portion, a small percentage of patients, but that may not help the patient who has blepharitis or meibomian gland dysfunction or other things. So we really need to look and see what the true cause is for the tear film or dry eyes.
Plus, that advice now would not be appropriate, as there's a national lawsuit against some of the biggest names in the big box stores about over-the-counter drops. And I hope everyone has heard about that on the news. If you haven't, then I guess it's okay to mention names. Walgreens, Target, Walmart, Family Dollar, Dollar Tree, and others are involved in that suit, as 2 people have died and 15 have gone blind because of ingredients in that over-the-counter drop that shouldn't have been there. And so the big lawyers are on it now. And so my advice would be just buy name brand solutions, and we have them at our locations too at competitive prices, or buy them wherever you do buy, but make sure it's name brand.
And I still get that question. I think when patients come in, and I'll usually ask them towards the end of the exam, are you using any eye drops or anything like that? And I know that a lot of patients bring that up, that they saw that or are well aware of that. And then we'll talk about drops that, you know, this is good or this is okay. But just be cautious out there. Make sure you're using a name brand. And I even have some patients that ask about dilation drops because of that, just to make sure everything is kosher and to make sure there's no risk or anything like that. But dry eyes is certainly a big one. The next one is glaucoma. And certainly we could do individual shows on every one of these that I just went through. But, just talking briefly about glaucoma, glaucoma is tough because most patients, especially in the early to mid stages, do not even know they have glaucoma, unless it was maybe an angle closure or one of the real tough ones where you have very high pressures and you could feel that. But in general, with primary open angle glaucoma, you could be losing vision and not know it until it gets late stage. And so that's one reason we certainly recommend patients come in at least on an annual basis. And certainly if you're a glaucoma suspect or you have glaucoma, we're seeing those patients probably on average about every 4 to 6 months.
That's true. It's the thief in the night, as patients are unaware that they have the disease.
So, yes, that's the reason. Sometimes it's, you ask about dilations and why do they need to look in the back of the eyes. And as we've talked about certainly on prior podcasts, we want to get you seeing better, but we also want to look in there and make sure everything's healthy too. If you're diabetic, if you have high blood pressure, and if we don't look at the nerve and we don't check the pressures, we would miss things such as, hey, you have glaucoma or you're at risk for it or you're a suspect. And so those are things we need to do to get a complete picture of the eye, to certainly make sure you're seeing well, but also to make sure, nothing's going to come back and bite you later on. UV protection, we can kind of skip around a little bit to that, but as far as UV protection, and I know I'm putting you on the spot by asking this, and we talk about UVA, UVB, as far as recommendations, whether it be lenses or even sunglasses, if a patient says, hey, what kind of sunglasses should I pick up, what would be your recommendations for us protecting the eyes?
Well, so many of the sunglasses that are over the counter have varying degrees of UV filtering. And there's three types: UVA, UVB, UVC. But UVA and UVB are the ones you need to totally block. And so the big name companies do a very good job at that, and you're sure of what you're getting. In addition, there's different tint combinations that are better, and you have to be careful with that. So when somebody wears an amber lens or a yellow lens, that changes their perception of color and also their perception of distance. So where things are a function of what kind of lens you're looking through. So when you're getting a cataract, for instance, your lens turns yellow inside, and when you look through a yellow lens, everything looks yellow. And you have to be careful with that in conditions where yellow could alter the perception of the distance from you. And so your depth perception gets funny. And at night or driving or under rainy conditions, these can concoct situations where you could come up short.
For sure. I remember, and we still fit it on occasion, but I remember when the Nike had their contact lenses back, and there was certain tints or for certain things to kind of help, depending on what sport you do you shoot, or, are you playing soccer, are you playing golf? Is it a fast moving or slow moving sport? Certain tints, have a better way to kind of identify the ball or pick up things depending on what the background is that you're looking at. One of the things we didn't talk about, especially because we're talking about women's eye health and safety month in April, is pregnancy in general. With patients who come in and they are pregnant, I know for me personally, what I usually will say, we'll go through the full exam, but I will always kind of say, hey, there's a chance that your prescription could change during the pregnancy. It's hard sometimes to predict that. Sometimes if it does change, it'll change back to what it was before. But if it does change, we usually see those patients back a few months post-pregnancy and do another refraction or kind of look at it just to kind of, to get that patient seeing good again. But there's always that chance that the vision would change. Do you notice that with pregnancy or what's
It's a small percentage, but there are also health issues that you need to watch. And over the years, I've picked up a number of cases of what's called preeclampsia, where the blood pressure gets high during the pregnancy and the patient doesn't know it. And they think the fluctuation is just due to the fact that they're retaining fluids, which is logical but incorrect. And so the only way to know that is to look inside the eye and look at those blood vessels and then discover that and get them to their OBGYN to get that blood pressure under control. And sometimes, to go to bed rest immediately or whatever is required.
So for patients who are diagnosed with preeclampsia or even gestational diabetes, come on in, get that eye exam, because like you mentioned, we're checking the health of the eye, and even if the vision may change, we want to look at the nerve, and if there's anything swelling or anything going on, we want to look at that. So certainly come in for that full exam. Let's jump to a few questions we've got. Let's see, patient question number one. I found, and this, we talked about tints a little bit already, but I found a website with purple tinted non-prescription cosmetic lenses. Are they safe to purchase and wear? Found a website, purple tinted non-prescription cosmetic lenses. Are we talking about contact lenses here? Is that,
yeah, they are. They are. First of all, that's illegal. And secondly, just like everything else, you can buy Levi jeans or you can buy jeans from other manufacturers or ones put together with spare parts. And these contact lenses do not pass the FDA rules, and therefore, if they do, they're either being what they call gray marketed, where somehow they've gotten a hold of them. But even if someone gets a hold of those lenses and they are legitimate, which most of them are not, then how have they been stored? And what happens to the solutions in those bottles under those different temperature conditions? Nobody stops to answer this because they don't care. They're just after the sale. And so you have to be very careful, again, with your eyes because you only get one pair of them. If you want to take that kind of risk, I often joke with the patient, you should do it with your teeth because you have 32 of them. Then you can go see the dentist and you can put false ones in if you botch that up. So there's a lot more leeway in that than in the visual system.
Well, not to mention any specific names out there, but even some of the places you can buy contact lenses online, it's older technology material. It's the technology we had, 15, 20 years ago, and they bought up the material then when we stopped using it because the decay value was so low, the oxygen wouldn't go through couldn't breathe through the lens. And so a lot of the material we have nowadays is a lot healthier, a lot better for your eyes and your cornea and all that. And so you've got to be careful too, even going online and getting some of these odd contact lenses as well.
Yeah, I agree. So we see the problems from those, other people don't. And,
Right.
You just assume because you're not aware of it. People think there's like one or two types of contacts. There are 12 major manufacturers right now, and they have families of lenses, and that gets complicated.
Well, the one thing I love about us as our locations, we're not married to any specific, brand or any specific company. We have every lens. I mean, if we don't have it, we certainly can order it. But we have quite a few, in house that you come for the exam that day, and we can fit most patients with a lens that day. So we want to fit what's best for you. Is it one that you want to sleep with? Is it one that you want to discard every day? Do you need a color lens? Can we get you, do you need one for astigmatism that corrects for that? Or do you need a multifocal? There's so many options nowadays. Do you need a hard lens? Do you need a hybrid lens, which is a combination soft and hard because you have keratoconus or corneal ectasia? There's a lot of different options out there, and we're not married to any one specific company, and we can order anything.
Some of the large national chains are married to one company, and the more volume they use on that, the bigger discount they get. But that's like fitting everybody in the same type shoe. I mean, it's not right.
Right. I mean, no doubt. So when you come see us, you're certainly going to get, what's the best fit for you. And if it's a toric lens or RGP, we're going to fit you that day, but we're most likely going to see you back in a week or two to make sure, hey, it's fitting well. Hey, make sure it's comfortable. Make sure your vision's good. And if not, or we need to adjust it or tweak it, we certainly will do that. Question 2, can I have prescription lenses put in a pair of sunglasses? If so, is that purchase FSA eligible, flex spending account eligible?
That's what that stands for. That's correct. Yes, it is. You can have them put in as long as they're put in properly. Okay, you can stretch a piece of plastic and stuff it in there, but it's going to come out depending on the temperature. However, if you cut it and put an edge on it or a bevel that's appropriate for the bevel indention in the frame, then you've got a one-on-one match and it'll stay in there.
Well, I guess from my experience in this, and more with the lab and everything, is the only ones I caution sometimes is if you get one of the curved sunglasses, like you mentioned, like the ones that kind of curve around the head and you have a high amount of astigmatism. To me, that's the only time I've seen, where there may be a little bit of an issue, but certainly just straight sunglasses. The curvature, I guess, more for like bicycle riders or, that kind of curve around, that sort of thing. But flex spending, yes. Anybody can come in, any regular glasses, sunglasses, you can use the FSA card. We even have some insurances now, and we take pretty much every insurance where they have, their insurance gives them a flex spending card or a debit card that they can use in-house to purchase things.
Yeah.
So certainly come see us. We have 5 locations. Each location is a little bit different. Each location we carry a little bit different as far as name brand frames and certain things. But we're all on the same system. So, if you want to move from one office to the other, I have some patients that come see me maybe at Fairfield or 9 Mile and they go down Palafox because they want glasses. We're all interchangeable. So we want to do, make it as easy and as convenient for each patient as we can.
We give the patient a lot of choices, and that's the major. Whatever the patient wants, they can get from us. There are no restrictions.
And as I kind of touched on a little bit earlier, we take 98% of pretty much every vision and medical insurance out there. So, even if you don't have a vision insurance plan, if you have a medical insurance, when you go see your primary care physician, if we find a medical diagnosis, we can bill that for the visit, for the full exam or the office visit. So give us a call if you not sure what your benefits are or what your copays are or this or that. We have a whole team in place that helps us.
5 people full time that do all that for you, file it, and fill out paperwork for you, and keep you abreast of the situation.
And the one thing I really try our best to do as far as not only doctors but billing department and front desk is try to explain to patients along the way kind of what to expect, what your copays are, what your fitting fees are. So there's not at the back end, hey, you owe us this or that. We want you to kind of know every step of the way, kind of what some charges are, so there's no shock and you're kind of well aware or educated on what's going on.
That's very important. People feel at home with that, and that's how you build trust.
Well, we're approaching the end. These things go so fast. I want to thank everyone for listening and watching again. Encourage all the listeners to like, rate, and review our podcast. If you're watching on YouTube, certainly like and hit the subscribe button. There's a couple different formats you can probably view or listen to this on. We appreciate you taking the time, and let us know what you think.
Stay tuned for our next podcast next month, and be on the lookout for our Facebook posts, where you can submit your Ask the Docs questions.
Bring the questions. We love the questions. Thank you, guys.